Order, order. I call Secretary of State Ben Wallace to make a statement.
Thank you, Madam Deputy Speaker. With permission, I'd like to update the House on Defence's support to the national COVID response. As honourable members are aware, I am committed to updating Parliament on our efforts, and the Ministry of Defence has been submitting weekly updates on the work to assist our outstanding NHS and colleagues from across government as we fight back against this awful virus. We might not be on the front line of this particular fight, but we are with them in the trenches, and since last year in increasing numbers. In fact, Defence's contribution to the COVID response now represents the most significant domestic resilience operation in peacetime, and more personnel are committed on UK resilience tasks today than at any time since the pandemic. That's why it's important to now make a statement to the House detailing the breadth and complexity of these activities. It is worth considering some statistics on what has been provided thus far. Since last January, the Standing Joint Command has received some 485 military assistance to civilian authority requests, MACAs, since the start of last year, some 400 of which have been related to our domestic COVID response. That is more than 3 times the average annual number. We currently have 56 ongoing tasks in support of 13 other government departments, with 4,670 personnel committed and almost 10,000 more held at high readiness, available to rapidly respond to any increasing demand. As is well known, the UK Armed Forces have helped build Nightingale hospitals around the country and distributed vital PPE, delivering more than 6 million items to hospitals and clocking up enough miles to circumnavigate the world 10 times. Personnel from all 3 services have backfilled oxygen tanker drivers, Welsh ambulance drivers, NHS hospital staff, such as those deployed to the Essex Trust this week. They have helped care assistants shoulder the burden in care homes and assisted testing programmes in schools and the wider community. During Christmas, when the new variant of COVID disrupted the border crossings, the military stepped up. While most of us were settling down for our festive dinner and break, the military were working with the Department of Transport to test hauliers crossing the English Channel and clear the backlog. Approximately 40,000 tests have been conducted in that operation. At all times, our people have shown fleet of foot, switching tasks as the occasions demanded, and while relatively small in scale, always having a catalytic effect. Our involvement in testing is a case in point. We deployed personnel to the City of Liverpool to support the first whole-town community mass testing pilot. The lessons learned along the way are now being applied in testing across the country, from Medway in Kent to Merthyr Tydfil, Kirklees, Lancashire, Greater Manchester. And only recently in Greater Manchester, I authorised the deployment of 800 personnel, and yesterday they began focused community testing. The country is, of course, eager to see the rollout of the largest vaccination programme in British history, and the NHS is delivering vaccines to those who need it at unprecedented speed. Defence's contribution has once again been primarily through planning support provided by Defence logisticians, applying their expertise in building supply chains at speed in complex environments. And as Brigadier Phil Prosser, Commander 101 Logistics Brigade, said in the No. 10 press conference last week, this operation is unparalleled in its scale and complexity. So as that operation has shifted from planning to execution and is now focusing on rapidly scaling up, Defence has been preparing to adapt to its support to the NHS. Not only have we sent additional military planners to assist the expansion, including in the devolved administrations, but following a request from the Department of Health and Social Care, we've established a vaccine quick reaction force of medically trained personnel who are assigned to the 7 NHS England regions. They can be deployed at short notice in the event of any disruptions to the established vaccination process and can be scaled up if required by any of the national health services across the United Kingdom. Throughout the pandemic, it is understanding the requirements that has been Defence's priority in order to tailor-make the most appropriate support. That is why we have sent 10 military assessment teams to each of the 10 NHS regions and devolved administrations. They are helping to assess the situation on the ground before formulating and coordinating the most effective response. For example, we currently have experts working at the newly reopened NHS London Nightingale, a hospital and a max vaccination facility that will help the capital handle COVID-19's second wave. Often Defence's efforts have been very visible, such as providing critical support to our overseas territories. Just last weekend, the Royal Air Force delivered more than 5,000 doses of the Pfizer vaccine to British citizens in Gibraltar. But we shouldn't neglect our armed forces, less visible, because their contribution is no less important. Our planners are now embedded in local authorities, working alongside the regional liaison officers, providing critical command and control and logistics support. They know how to deal with deadly diseases like Ebola and how to stay calm under pressure. Those cool heads have been pivotal, not just in coordinating efforts, but assessing how and where Defence can deliver the best response. I've mentioned the personnel we have deployed or held at high readiness, but the real number helping the nation to combat the coronavirus is far greater. We have in excess 5,000 Armed Forces personnel and civilian staff supporting the COVID response from behind the scenes as part of their routine duties. Today, I want to pay tribute to these men and women. They include the hundreds of personnel in Defence headquarters responsible for coordinating COVID support force. Among them, 100 staff of the MOD's Winter Operations Cell, a similar number working on COVID planning at Standing Joint Command, and 100 more facilitating COVID operations as part of their regular jobs in the Joint Military Commands. From the Defence Medical Services, we must not forget that we have more than 1,600 consultants, clinicians and nurses and trainees fully embedded in the NHS all over the United Kingdom. And as ever, they are working alongside their civilian counterparts. And some of those civilian counterparts themselves are also military reservists. And at our globally renowned Defence Science and Technology Labs, DSTL, there are 180 scientists and technicians working across 30 different COVID-19 related projects, supporting the government's scientific understanding. Meanwhile, our expert analysis and defence intelligence have studied how COVID-19 spreads, and our procurement specialists have been busily supporting the acquisition of unprecedented quantities of PPE and equipment. This has been a truly national and whole force response, uniting regulars and reservists, soldiers and academics, sailors and civil servants, some of whom the Prime Minister met yesterday when visiting the Ashton Gate Mass Vaccination Centre in Bristol. Yet even as we respond to this pandemic, we must maintain our day job guarding the nation from dangers at home and abroad. Despite the virus, troops continue to manage wider winter tasks such as flood protection, counter-terrorism and the EU transition. And we have maintained our momentum in operations critical to security, whether striking terrorists in Iraq, deterring Russian aggression in the Baltics, supporting UN peacekeeping in Mali, or maintaining our continuous at-sea deterrent. It goes without saying the safety and welfare of our people is paramount. I can reassure the House that we have rigorous and robust measures in place to protect our personnel and reduce risk to themselves and their families while carrying out their duties. So let me assure the House that our armed forces remain resilient and ready to support the NHS and colleagues across all government departments. Now as ever, come what may, they stand ready to do their duty, however, wherever and whenever they are needed. I know some colleagues are keen to see the armed forces take a more leading role, but I should make clear that our Constitution quite rightly ensures that our military responds to civilian requests for assistance. They act in support of the civilian authorities, but are always ready to consider what more they can do to provide that support. Together, we will do our bit to beat this deadly disease and help our nation get back to normality.
Shadow Secretary of State John Healey.
Thank you, Madam Deputy Speaker, and can I thank the Secretary of State for the advance sight of this statement and welcome this direct update to the House. It is the chance for us all to thank and pay tribute to the 5,000 Forces personnel, both regulars and reservists, who are currently providing COVID assistance, and to the leadership from Standing Joint Command under General Ersch. The Labour leader and I saw firsthand in November, Madam Deputy Speaker, the professionalism and the commitment the team at Aldershot bring to this task. The public also welcome the important contribution our armed forces are making to help the country through this continuing COVID crisis. From troops on the front line building the Nightingale hospitals, community testing or driving ambulances and tankers, to the planners, analysts and scientists behind the scenes. The military is an essential element of our British national resilience, and people can see this more clearly now than perhaps at any time since the end of national service. So I trust this will reinforce public support for our armed forces and help redefine a closer relationship between the military and civilian society. But I sense a frustration from the Secretary of State in this statement. The government has been too slow to act at every stage of this pandemic and too slow to make the fullest use of the armed forces, as I and others on all sides of this House have argued since the summer. During the first lockdown, the COVID support force was 20,000 strong, yet fewer than 4,000 were deployed. The winter support force numbers 14,000, yet now, even with what the Secretary of State calls, and I quote, the most significant domestic operation in peacetime, just 5,000 are being used, with only 56 military aid requests currently in place. How many of the 14,000 troops does the Secretary of State expect to be deployed by the end of the month as we confront the gravest period of this pandemic to date? On vaccinations, it is very welcome that from this week the armed forces are finally being used to help deliver the nation's #1 priority, the national vaccination programme. The Secretary of State has said that 250 teams of medical personnel are on standby, yet only 1 in 10 are set to be posted this week to the 7 NHS regions in England. When will they all be deployed and working to get vaccines into people's arms? We in Labour are proud that Britain was the first country in the world to get the vaccine, and we want Britain to be the first to complete the vaccinations. We want the government to succeed. So does the Secretary of State accept there is much more that military medical teams can do to help? On testing, we also welcome the work being done across the UK to reinforce community testing from Kirklees to Kent and in the devolved administrations. 1,500 personnel had also been provided to support schools with COVID testing. Now that schools have moved to online teaching, what changes are being made now to those plans? And when infection rates come down, testing will again be vital to control the virus. Yet the £22 billion NHS track and trace service is still failing to do the necessary job. There's no military aid agreement in place for track and trace, so can I suggest the Secretary of State offers military help to get this outfit sorted out? And finally, Madam Deputy Speaker, can I turn to services personnel themselves? MOD figures confirm the average number of tests for defence personnel since April has been just 1,900 a week. So with 5,000 troops now deployed on COVID tasks in the UK and more on essential operations or training overseas, what system is in place to make sure these personnel are regularly tested, and what plans does the Secretary of State have to ensure they're also properly vaccinated? The challenge of COVID to this country is unprecedented. The Chief Medical Officer said yesterday we're facing the most dangerous situation anyone can remember. So if the Secretary of State seeks to expand the role of the military in defeating this virus, he should know he will have our full support.
Secretary of State.
Thank you, Madam Deputy Speaker. I'm honourable to the right honourable gentleman and grateful for his questions. Look, first of all, on the issue of military willingness to engage, we are, of course, as he knows, incredibly keen and eager to offer whatever assistance we can. And I'll address his questions on the range of those subjects one by one. One of the reasons we invest people as planners in the heart of both departments and local government is to make sure that we shape that ask as it develops and make sure that we are dealing in the art of the possible as well as dealing with requests that are realistic in being able to deploy. Sometimes we get initial requests of thousands of people And once you scale it down and you work through what's required, it ends up being a couple of hundred. That has been partly because some of the departments or local authorities are not used to Maccas. So, fun enough, departments used to using Maccas, or indeed, like local government, MHCLG would be, or indeed local authorities who've had significant flooding in their time, will be very used to that relationship. For others, this is a new experience. The Honourable member asked about the scale between the designated force and then the force actually used. So he is right to say there was 20,000 earmarked for the COVID response at the beginning of this, and that 4,000 to 5,000 were deployed. That was at any one time. Because our forces, obviously, as he knows, work 24 hours a day, 7 days a week, we rotate many of these personnel through, that they are maybe at any one time deployed, right now 5,000, but there will be 5,000 people earmarked to becoming much more ready, in a higher readiness. To be at a 24-hour readiness or a few hours readiness is a huge demand on anyone, to effectively be sitting in your house waiting to be deployed or in your barracks. And so we rotate the forces through the different readiness stages. One might be 24 hours, one might be 3 days' notice to move, one might be a week's notice to move. Those different readiness stages mean that they can either get on and do their day job, or it means that they basically have to just stand and wait. And that means, of a force of about 14,000, which is currently earmarked, yes, we've got 5,000 today, but I suspect the time we've got through this phase, somewhere between 10 to 12,000 of that 14,000, if all demands remain, those individual personnel will have been used at some stage on the COVID response. That will be taking that 5,000 that's on today, they'll come off, they'll get a period of rest, they'll get a period of build-up time with their families, and they'll come back again. So the force is a fixed amount of where we draw the different readinesses, but the deployments obviously are drawn through that. And of course, all members of the Armed Forces personnel are available is probably the wrong word, are able to help the government in its resilience and its defence. That is obviously the purpose of their job. On vaccinations, first of all, we've got over 100 people in the planning process of delivering the vaccination and the rollout across the whole of the United Kingdom, both in Scotland, Wales and the England and indeed in Northern Ireland. But we also have, at the moment, 21 vaccination teams, sort of quick reaction teams, who are usually staffed by a doctor, some combat medics and nurses, and their job in that sort of team of 6 is to deploy as required. And in reserve, we are holding 229 in reserve, should we wish to deploy all 250. And vaccines at the moment are really the limiting factors, we'd say, will be the delivery schedule and timetable of the actual vaccines themselves. Of course, I could deploy 100,000 soldiers tomorrow ready to vaccinate, but if the stock isn't there, then we'll have people we could employ them better off. And so we are very, very keen in the government. The Prime Minister is determined to make sure that we match both the pace of stock delivery, but also the pace of delivery into people's arms, the jabbing. And we are very, very clear that we can do more to assist. The Prime Minister knows that, and the Prime Minister has indicated that we will be called on as the NHS requires it. But we shouldn't forget that in vaccinations, the NHS are also recruiting tens of thousands of volunteers and former clinicians and former nurses also able to do this. This is not a pure military response. In answer to the question around testing and tracing, we've had a one-star within the test and trace organisation from very early on. We have, as you know, Madam Deputy Speaker, with schools testing, we originally earmarked 1,500 personnel. We have reduced that down to about 800 who stand by not only to help where needed in the schools that are currently taking, obviously, key workers' children, but also in helping talk through webinars and remotely people in how to administer the lateral flow test. So we stand by ready to do more if required. We have scaled it down slightly simply because of the school closures, but we stand ready to increase if that is required. On the area of I've got something. The personnel themselves, when they deploy on a MACA task, like the 800 personnel deployed to Manchester, they will be tested before they go. Throughout that process, they will then abide by whatever the current NHS guidelines are. If you feel ill, you should get a test, or indeed, if we feel they're going in front of people that are vulnerable, then we will make steps to test them. And very quickly, if people are found to be testing positive, they are isolated. I can get the latest figures for the House if that helps, because of course the lateral flow test has opened up a huge amount of much more easily accessible type of testing to do that. Look, I'm grateful for the Right Honourable Member's support of our defence. I can give them the assurance that both the Prime Minister and myself are absolutely determined to lean into this problem, to maximise our efforts wherever we can, wherever we see an opportunity, instead of waiting for an argument about who does what, offering to do it. That's why only recently you saw us fly out those vaccines to Gibraltar. You put it on a plane, get it out there, get it done. We can have all the arguments we want after the fact. Let's get on with it. We're all united in working, and I know the opposition, the loyal opposition, is also united in working to help deliver that. Defence is doing its bit, but we shouldn't forget it is doing its bit alongside the amazing people of the NHS who are day in, day out on that front line in the tens of thousands.
Order. We do have 1 hour put aside for this statement, which I can extend slightly, but not by too much. So I would ask colleagues to make brief, succinct questions and fairly brief answers as well. Sir Roger Gale.
Thank you, Madam Deputy Speaker. You'll know that I've not always been uncritical of the test and trace process, but I do believe in giving credit where credit is due. Yesterday, a member of my team had occasion to take a COVID-19 test at the Birchington-on-Sea Village Centre in North Thanet. Now, that centre was staffed by soldiers of the Gurkha Regiment. Those attending report that their conduct was exemplary, they were courteous, patient and efficient, and the results were recorded in short order. So would my right honourable friend convey my thanks on behalf of my constituents to Brigadier Phil Prosser for all of the work that these and thousands of men and women of the armed forces like them are doing in the war against the pandemic.
Yes, the right honourable gentleman is very kind to say what he said about the efforts in Kent. We have 360 personnel supporting Kent County Council on the lateral flow testing, as well as obviously he saw this considerable number in the problems over the Christmas. I'll pass on his thanks to Brigadier Prosser, but of course Brigadier Prosser is the lead of vaccine. We have a number of other senior military personnel leading in the different areas, test and trace and building NHS capacity. So Brigadier Lizzie Faithful-Davis is the lady in charge of that for the military response. But I think what I would say is what's amazing is these military personnel, they're joined to be soldiers, they're joined to be Navy, and they do what they're doing today with the same professionalism and enthusiasm as they would be doing their day job. And I think that's a tribute to the training, the quality of the personnel, and of course the Gurkha Regiment that he refers to.
We now go to the SNP spokesperson, Stuart Malcolm MacDonald.
Thank you, Madam Deputy Speaker. I'm grateful to the Secretary for advance sight of his statement, and I think it was only right that he took the time to outline all of those who are frontline and not frontline within the defence community who are working so hard and so professionally to get us through the pandemic. On behalf of my party, I thank each and every single one of them for the work that they've done. And I think, in fairness, because of their professionalism and the way in which they've carried out their job, the Secretary comes to the House actually with a good story to tell today. So if I could just press him on one or two issues. Can I start with vaccinations? Could he perhaps adumbrate to the House exactly where those in defence who are working on COVID stand in terms of the queue, if I can put it like that, for receiving vaccinations? And would he be able to give us an idea of how many have been vaccinated themselves so far up to this point? And my second question is much more broad, and it concerns the issue of resilience, which I know the Secretary knows is something that I am keen on. But of course, if we're to do resilience properly, it can't just be the preserve of the Ministry of Defence, and I know that he understands that. So can he tell us how the pandemic and the lessons from the pandemic, as far as resilience is concerned, may be reflected in the integrated review. And if you can go one further and tell us when that might be getting published, I'll even buy him a dram when we're next allowed to.
Well, I think I should go for the easy one. The current target date for the IR is the first 2 weeks of February, so we'll go for a half on that. To the honourable member, first of all, none of our defence personnel have received a vaccination. They're not in the priority groups 1 to 4. However, we are, as we speak, working through a very working out on what key cohorts should be vaccinated in order to preserve and underline the nation's defence. So obviously they will get priority, but I expect them to be a small group at first. That is because simply protecting the priority groups 1 to 4 is important. I think the lessons of resilience, one of the lessons is reserves. And the Scottish Government is empowered to create an NHS reserve if it wished to look at that. And I think that will be one of the lessons that we will draw in England and Wales, is that we use the military reserves, but also potentially for those people that want to contribute to the reserve of the nation and the resilience of the nation, then maybe other departments may start considering that as well. And I'm sure the Scottish Government, under the devolved powers, is absolutely entitled to look at that, and I would definitely recommend that as well. Just for his peace of mind, there are currently 3 personnel working in airlift in Casavac and the Scottish Ambulance Service, 32 planners in the region to support community testing and vaccination deployment, and 25 planners in the Scottish Government and NHS Scotland helping work through those problems. And of course, we stand ready for more. If you request more through the Scottish Government, we will of course stand ready to provide that assistance to make sure the whole of the British Isles and the United Kingdom get through this issue.
Now go to James Gray.
Thank you, Madam Deputy Speaker. Can I, first of all, join the Secretary of State in thanking all the military personnel involved in every way for all they've done in this national effort. They're always ready to step up to the mark. But will you also acknowledge the huge contribution being made by St John Ambulance, who are training up to 30,000 volunteers, the highest standard, to be vaccinators, and will ensure that military planners and those on the ground work hand in hand with St John and also with Red Cross and with the Royal Voluntary Service to maximise the contribution they can make.
Yeah, the honourable gentleman raises a really interesting point. Volunteers need managing. While the St John's Ambulance Service is a disciplined, uniform service, the huge amount of people that are being recruited to volunteer will need managing. And that's certainly one of the areas we think the military can assist the NHS, which is how do we manage lots of volunteers deliver at a productive and efficient rate things like the vaccine. And I think that's where you'll find the military working hand in hand. And it's another example of it's not just the front line, it's not the front trench. Often the skill we can bring is, how do we look after 200,000 volunteers or 50,000 volunteers and make sure they are used correctly in the right part of the system. And the St John's Ambulance will be able to deliver a very efficient group of volunteers because that is their business, and we look forward to working with them.
Now go to Jamie Stone.
Thank you very much, Madam Deputy Speaker. Can I also express my sincere thanks to our United Kingdom Armed Forces for all that they have done. Now, my vast and faraway constituency presents very special challenges: remoteness of where people live, an ageing population, one that is statistically rather different to the rest of the UK, and also this issue of distance that people might have to travel from far corners of my constituency to Inverness or to Wick to be vaccinated. Can I press the Secretary of State to please, the quick reaction teams that he refers to, I hope that they will be involved in helping my constituents be vaccinated. And could he just remind the Scottish Government that they are there, they're there to help, and working together, we can give my constituents the security which they need.
Yes, the honourable gentleman knows I know his part of the world very well, having represented Aberdeenshire, the north part of the North East Scotland, in the Scottish Parliament with him 21 years ago. He reminded me the other day. I had hair. Madam Deputy Speaker, which why at the beginning of this we deployed helicopters up to Kinloss to make sure we look after the Highlands and Islands, and we stand by ready to do that. Notwithstanding the fact we've got planners in the Scottish Government to help, at the moment we haven't received a MACA request for the use of some of these quick reaction vaccine teams, but they are there for the taking if they are asked for, and I am very, very happy to support and sign off any requests like that to do do so. The vaccine, obviously, some of it is obviously coming from abroad, and we need to distribute this to the fingertips of the United Kingdom.
Thank you. And just a reminder, we are now halfway through the allocated time, and we've only got through 5 people. So just to press colleagues to have short, concise questions. Alexander Stafford.
Thank you, Madam Deputy Speaker. Can my right honourable friend confirm that his department is working with the Department for Education to ensure that those schools that must remain open, and especially those in Rother Valley, have the support, guidance and materials they need to offer rapid testing to their staff and students over the coming weeks?
Yes, we have. While we had earmarked originally 1,500, we've scaled that down to 750 personnel ready to assist schools. Currently, we've deployed 84 to assist 52 schools and colleges. They stand by all over Wales and England to do that if you need the help. And if the Welsh Government requests that support, we will be able to both physically support it or indeed help online to make sure that the staff understand how we can deliver the lateral flow testing.
We now go to Carla Lockhart.
Thank you, Madam Deputy Speaker. It's tremendous to hear that the armed forces are playing their part in the rollout of the vaccine across Great Britain, and we thank them for this. However, the one part of the United Kingdom where we seem to be proceeding without the same level of military assistance is Northern Ireland. If this continues to be the case, we will be missing the opportunity to alleviate critical pressures on hospital, to speed up the rollout of the vaccine and to lift the burden on GP services to both roll out the vaccine and keep general practice services functioning at the same time. Can the Secretary of State confirm that the MOD are ready and willing to accede to any request for support from the Northern Ireland Executive? And if such a request has been made by the Health Minister for Northern Ireland?
Yes, the Honourable Lady at the beginning will remember that we did indeed devolve military assets to Casovac patients to England at the beginning of this process who were ill, and indeed we had earmarked and agreed to a MACA request for the use of defence estate at Kinnear and Aldergrove at the time. We do have and have been preparing support to allow NHS staff to refocus or to be released onto the front line. We are awaiting that MACA. We believe there is one inbound. We will obviously accept any request, look at it on its merits, but there is no, from the MOD's point of view or indeed the UK government's point of view, there is no specific bias to any part of the United Kingdom. As the requests come in from the civilian authorities or the devolved administrations, we are ready and willing and able to meet them.
Now go to Alex Shelbrook.
Thank you, Madam Deputy Speaker. Could my right honourable friend assure me that the critical task of the defence of our nation and our commitments to NATO operations and exercises are not being compromised in order to provide this support?
No, our critical defence tasks are being maintained. I visited at the beginning of December Estonia to see our forward presence there, working alongside the Estonians. Our continuous at-sea deterrent is just that. It is continuous, and indeed, as is our air policing and our Navy deployments. We have taken no eye off the ball, let's say, when it comes to defending the nation, but at the same time shows the importance of concurrent activity and resilience in being able to deliver other tasks that were definitely unforeseen a few years ago.
Now go to Kevan Jones.
Thank you, Madam Deputy Speaker. Can I join the Secretary of State in thanking members of Armed Forces for their work during this pandemic, and also MOD civil servants and those working at DSTL. The government quite rightly prioritising those most at risk for the vaccine rollout. But can I ask the Secretary of State what discussions is had with the Department of Health about rolling out the vaccine amongst defence personnel who are working on defence critical missions such as maintaining CASD?
Well, obviously, as I said earlier in an earlier question to the right honourable gentleman, we have discussed with the NHS. We're working on a list right now about who we could prioritise to make sure that we underpin the very, very important defence tasks. Of course, things like continuous at-sea deterrent will be included in those discussions. It is vital that it remains continuous. But also, as we go through priorities 1 to 4 into the after, further down into the vaccine programme, as you say, key industries, key people that will help help keep the country and defence going. And can I just echo what he says also? We often focus on the men and women in uniform. Defence is more than that. It is the scientists, it's the civil servants, it's the logisticians, it's the reserves, and it's actually often the retired community and veterans as well. And I want to pay tribute to them because they have been as important in a large part of this process. And I often feel for the civil servants in the MOD who often, slightly can get forgotten in the narrative. It doesn't mean to say we forget in the reality, but they have been doing an amazing job as well. My civil servants have been working through alongside our military personnel throughout this process.
Now go to Sir Geoffrey Clifton-Brown.
Thank you, Madam Deputy Speaker. The entire nation should be grateful for the adaptability of our armed forces, whether it be from the rapid building of the Nightingale hospitals, rollout of PPE, or help with track and trace. But as we build up with vaccine deliveries for the unprecedented task of vaccinating the majority of the nation, can my right honourable friends set out what role the armed forces will play in that huge task?
Yes, Madam Speaker. As I've said right from the beginning, we are involved with the vaccine task force, making sure that we are there right at the sort of front line to make sure we can jump in and fill any gaps that emerge. We have set up these quick reaction force. There'll be up to 250 and more if required that could go out and take vaccines to people when that stock is, or if that stock is needing to be delivered. That could deliver a significant uplift in the numbers of people being injected if they are required. At the same time, we have embeds in the regional vaccine sort of offices of the NHS, where the NHS is planning how it's going to deliver the vaccine in the regions and indeed in Scotland, Northern Ireland and Wales, to make sure that wherever there is a gap, the MOD will try and fill it.
We now go to Dan Jarvis.
Thank you very much, Madam Deputy Speaker. Like so many, I'm extremely proud to see our dedicated servicemen and women supporting the national effort to overcome the public health crisis. The overwhelming majority of Britons now see disease prevention as an issue of national security. So, can I ask the Secretary of State how coronavirus is shaping the forthcoming integrated review?
Well, from a defence point of view, and indeed from my own background as Security Minister, resilience was very, very key to the integrated review. One of the ways I felt very important that the integrated review should be used is to enhance the use of reserves. Reserves are going to be part of the long-term future of this nation's resilience, whether they are civilian reserves in a sort of NHS environment, or indeed whether they are from the armed forces. They are going to be very important, and we need to look at how we employ our people to make sure there is a flow between regular and reserves and they are used in a much better way. In addition to that, it shows the threat of silent or sub-threshold enemies, disinformation. We have seen Russia already deploy smears and innuendos and disinformation against our Oxford AstraZeneca vaccine, at the same time as elements to try and steal secrets through cyber. And that's a really important example of how we have to be on our guard when our adversaries take advantage of natural disasters or natural phenomena. And so we deployed and used 77 Brigade through this process to challenge disinformation, which is obviously something that I think is appropriate use of 77 Brigade. Make sure when a foreign country makes something up, spreads a rumour and tries to undermine us, we should challenge that. So I think all those lessons are being effectively, well, all those policies are being proved in this pandemic. I think that's what I would say. And I think you'll see in the integrated review, front and centre, resilience is being one of the main things we must always focus on if we're to defend the nation.
We now go to Sir Bernard Jenkins.
Thank you, Madam Deputy Speaker. This is undoubtedly the greatest national emergency of my lifetime, and yet only a small fraction of the available military capacity has been called upon by the rest of the government. And that's despite the fact that the test and trace operations have been indifferent in their performance, and the vaccine programme seems to be dependent almost entirely on civilian capability that's tested every winter in the best of circumstances. Why does my right honourable friend think the government, perhaps the rest of the government, is so confident that civilian organisations are capable of delivering these incredible tasks of such scale and magnitude, importance and urgency without significant more military capacity, particularly 4-star military capability at the top of these organisations rather than just 1 star?
Well, I can assure my right honourable friend that the 4 stars and 3 stars are equally busy. I just came from a meeting with a 3-star and a 4-star on exactly that, on the vaccines, to make sure we are leaning in as much as possible. Look, I understand what the honourable friend is saying, but look, fundamentally, the armed forces has been making a difference. If there is more demand, or indeed an easy way to deliver this, the solution to this pandemic, we would have been doing that. And also, it is not the case that when we talk about numbers of the armed forces, that they are sitting around not doing anything until they're called. He recently called for more assistance to the NHS in Essex. You know, I looked at a number of requests that came in last week and the week before, and it was quite sobering to realise that of the 1,600 clinicians and senior nurses and nurses in the armed forces, regulars, they are all deployed. They are all working in hospitals in Middlesbrough, working in hospitals in the southwest, working in Birmingham, working in the southeast. They are all there because even in peacetime, even when we're not fighting a pandemic, instead of having them sitting around, we make sure they're working in the NHS, augmenting that time. And some of the requests were in danger of robbing Peter to pay Paul. I would be simply taking clinicians out of one hospital trust to move it to another one, and that isn't going to solve the challenge we have. So I understand what he says. What I can give him the assurance, as I gave the Right Honourable Member, the Labour Defence spokesman, is that we stand ready to do it. It's not like we sit and wait in our rooms waiting for a phone call. We push, sometimes to the annoyance of some of my colleagues. I push and agitate. I'm quite a good agitator, Madam Deputy Speaker, to make sure we try and deliver wherever we can. The Prime Minister is absolutely open to all ideas, and we do on many occasions.
We now go to Marion Fellows.
Thank you, Madam Deputy Speaker. The armed forces have played a prominent role in supporting frontline public health services in Scotland, and their support has been welcome. What discussions has the Minister had with devolved officials prior to this further commitment of military personnel? And what discussions has he had since to ensure the effective targeted allocations of personnel within communities and in vaccination sites in Scotland?
Well, I haven't had numerous discussions with my Scottish counterparts because I took the decision at the beginning of this outbreak to devolve my authority and the asset to the professionals who we have embedded in both the local authorities and the ministries and indeed the devolved administration, so they can just get on their jobs uninterrupted. So my military planners that are sitting in Scotland with the Scottish Government, with the NHS, the only barrier to them being used more is whether the Scottish Government chooses to use the assets that are available or not. It is entirely up to the First Minister of Scotland whether she wishes to use more British military assets or not. I don't get in the way of it. I don't need phone calls with her. She has those people at her disposal. And if the Honourable Lady, and I know on Twitter she had said it previously a few months ago that we should do more, if she'd like us to do more, I would suggest she raises it with the First Minister of Scotland.
We now go to Dr. Julian Lewis.
Although our service personnel are already making a fine contribution, has my right honourable friend examined which aspects of Israel's efficient and highly successful vaccination programme involving her armed forces might be applicable to our own use of military medical resources?
Well, I think one of the lessons, a bit like the Honourable Member asked earlier about lessons from the IR, is Israel, like a number of European countries, have huge numbers of reserves or reservists. Slovakia as well, or Slovenia, I think, almost mobilised their whole 3 million or millions of people. And Israel is very deep on reserve. So I think, first of all, the lessons from that is they have been able to mobilise people through a reserve capability that they have. And I think that's one of the lessons. Secondly, that the element of 24 hours a day, 7 days a week, how much more can we do? How how much more assistance can we squeeze into a day? That is a conversation that is very live right now between me, the Department of Health and the Prime Minister. If we can do it, we will do it. And I think at the moment the limiting factor is just simply the stock coming in. But as the stock picks up of actual jabs, I would expect us to push more and more on that, or indeed taking the jabs to people.
Now go to Helen Hayes.
Thank you, Madam Deputy Speaker. Hospitals in several parts of the country are reporting concerns about oxygen supplies. Has the Secretary of State had discussions with the Department for Health and Social Care about the provision of armed forces support with oxygen supply logistics to ensure that oxygen is available for every patient who needs it?
Yes, John Willow, but right from the very start, our drivers have augmented oxygen delivery around the United Kingdom, or certainly from England and Wales. We continue to do that. I think we have a number of personnel actually doing that right now. If there's more required, we will. And if we have to go and find more oxygen, we will go and help with that in the logistics chain. Brigadier Prosser from 101 Logistics Brigade, one of those tasks of that logistic brigade is to help in areas like oxygen supply.
Scott Benton.
Thank you, Madam Deputy Speaker. Local authorities in Lancashire continue to benefit from the invaluable support which our armed forces are providing in relation to mass testing programmes. However, I understand the existing deployment is due to be scaled down over the next few weeks as our due to be scaled down over the next few weeks, a decision which was taken before local infection rates started to rise once again. In light of recent events, will my right honourable friend consider extending the current deployment so that all local authorities in Lancashire, including those on the Fylde coast, can continue to benefit from this invaluable resource?
Secretary of State.
To my honourable friend, I visited the North West regional sort of response and spoke to the Lancashire leaders and then the Greater Manchester leaders and the Mayor, Andy Burnham, on a whole range of these things. It isn't due to be drawn down other than on many MACAs you put a time limit on it to make sure you examine whether it continues or whether you need to modify it and learn lessons. We will do whatever is required in Lancashire and the North West to deliver and improve test and trace, to make sure we're taking the testing to the very people you want to find where infection is, because if you can find people with no symptoms but who are infected moving around the community and you can isolate them, then you can really help slow it down. In the same time, as he will know, one of the sites for vaccinations opened obviously in Blackpool as well, making sure that hand in hand we go with the testing, goes the vaccination.
We now go to Mr Tamanjeet Singh Desi.
Thank you very much. Madam Deputy Speaker, I would like to commend our wonderful armed forces personnel for continually putting their shoulder to the wheel in the midst of a national crisis. Secretary of State, the mass vaccination centres don't just require medical staff, but logistical, clerical and steward staff to manage the huge flows of people every day. Does he agree with me that the armed forces personnel could and should play a more significant role in providing these services so that vaccination centres in local communities like Slough and the rollout mobile vaccination units have the resources that they need?
The honourable member is absolutely right. It's not just the clinical touch. So I think in a vaccination process, when you go, it can take about 25 minutes. The actual time that you're in front of a person with a needle and injected is minutes, 3-4 minutes. The rest of that time can be stewarding, can be keeping an eye on people, making sure that they find the right places to go. And right now, his question is timely, because right now that is a discussion we're having with the Vaccine Task Force and the NHS about how can we augment that to make sure that the nurses and the clinicians focus entirely on the clinical part, and therefore the throughput can increase, but we can help with things like the stewarding and indeed the marshalling, I suspect, of all the volunteers as well.
We now go to Caroline Noakes.
Thank you, Madam Deputy Speaker. My constituent, Dr. Sheila Fitzpatrick, contacted me yesterday talking about her application to get into the process to be a volunteer vaccinator. She used the phrase, "This needs the intervention of the military." I'm sure she'll have been pleased with my right honourable friend's statement today, but can he explain perhaps how army logistics can be used to make sure that those volunteering end up in the right place?
I'm tempted to say that a good sergeant major will be able to fix a lot of that. I mean, it goes to the point that, as I said earlier, volunteers need managing and they need working out their needs because they often volunteer, that they can't do the same. We can't lean on them as much, maybe, to do the same number of hours, but also making sure that we match troops to task, as we call it, making sure that the skill set's in the right place. And that is, as the Honourable Member for Slough was just asking, the same sort of question, which is what we're doing at the moment with the NHS is to discuss exactly how we can increase and augment that, because our skill set is often just that, making sure, the Sergeant Major makes sure the people are in the right place at the right time, doing the right thing. And let me tell you, I never said no to my Sergeant Major.
We now go to Harold Williams.
Thank you, Madam Deputy Speaker. I welcome the support of the military in the vaccine rollout. I have a particular concern about delivery in rural areas. Can the Secretary of State reassure me that there is a military capacity available, perhaps in the reserve, to operate in extreme conditions, for example, in heavy snow in the rural and indeed in mountainous areas?
Yes, I mean, first of all, we have 100 personnel supporting the Welsh Ambulance Service and 92 personnel supporting the Welsh Government in the Welsh vaccination rollout. Of course, one of the benefits of both the vaccine quick reaction forces and indeed the military personnel is most of us did our training up in the hills of Brecon and Sennybridge and areas like that and are used to adverse weather. It's also why we're equipped to deal with it, and that's one of the strengths, and I hope one of the opportunities that the Welsh Government will take advantage of if needed, to go out down the rural communities, down the small tracts and the hill farmers to make sure they get the vaccinations and indeed the support they need.
We now go to Alicia Keynes.
Thank you, Madam Deputy Speaker. Will my right honourable friend please join me in thanking our wonderful armed forces, in particular those based at Kendrew Barracks in Rutland, who the Minister for the Armed Forces visited this week to see their vital contribution to defeating COVID firsthand. But following misinformation this week in Rutland and Melton, can my right honourable friend please confirm that the military are not deployed anywhere in our country to enforce or police COVID restrictions?
Yeah, look, the military's response is about, obviously, that it's a response to help other civilian authorities meet their requirements. And we have been very clear that enforcement is not our job. Our job is to help the police, insofar as backfilling them to free up the police should they need to do more on the streets. But our main job is around logistics, planning, mass, e.g. for mass testing, and indeed around things like helping deliver the vaccines with our specialists as well.
We now go to Chris Elmore.
Thank you very much, Madam Deputy Speaker. The Secretary of State has rightly praised the armed forces, but also made reference several times to reservists and the work that they've done, especially in dealing with testing at the border with France before Christmas and over the New Year period. So would the Secretary of State in that vein reconsider his decision and indeed reverse it into his decision on the number of training days that he has now decided to cut for reservists, as clearly they are of huge importance to our response to the pandemic?
He will know that, first of all, that the training days may not necessarily align to what the COVID task is. But secondly, we have a budget we have to be obliged to. We have significant pressures in the budget. The record settlement we got doesn't start till next year. And what we didn't do was cut reserves. What we did do was cut down on some of the reserves days within this financial year. That does not take away from the future. It just meant that we had to meet some of the financial pressures across the board. It's not the only measure at all we took. It's a significant pressure. And that's why the record settlement that kicks in next year will help us make sure we have a much more holistic approach and a more sustainable deployment of our armed forces.
Teresa Villiers.
As supplies of the vaccine expand over the days to come, is the military ready to step up its participation in getting those vaccinations out, particularly to our frail elderly, so that they can get not only the first dose but the second dose, so that they're protected from this terrible virus?
Yes, the Right Honourable Lady. should be reassured. I just came from a meeting on exactly that, making sure that as the delivery profile of the vaccines increases, that there is no gap in that delivery. And if there is a gap, that we are designed and ready and standing by to assist in delivering that. And in fact, getting ahead of it. One of the lessons, a number of members have asked about the lessons for the IR, anticipation, better planning, longer planning, making sure we know what's coming next. That's one of our strengths. That's one of the things we can export to other government departments. And on the vaccines, we're right at the centre of trying to do that.
Now it's Toby Perkins.
Thank you very much, Madam Deputy Speaker. I share the admiration for our armed forces that many other honourable members have highlighted, and also share the frustration that the Defence Secretary and other honourable members have expressed about the fact that there are so many people allocated by his department that aren't actually being utilised by the government. Can the Defence Secretary tell us whether there are other barriers that are preventing government department from taking up this opportunity, such as accommodation or any other budgetary concerns? Can he be assured that in Chesterfield we have many hotels that would be very happy to accommodate members of the armed forces if they can help us speed up this vaccination programme?
Well, first of all, I can assure you that when we do deploy our armed forces, we do our best to make sure that we're in the community. Many of the armed forces, for example, helping Greater Manchester, are deployed amongst many of the hotels in that area. Look, my experience over these last almost year has been that the driver for demand is often, not as straightforward as people think. It's not secretaries of state just picking up a phone and saying, I want to send thousands of people there. The demand is driven often from ground up. It's often driven by local authorities or regional leaders alongside regional NHS demand. And I think that is what we have to remember. And there are plenty of places who have managed within their own resources to deliver. But the trick is to make sure we anticipate. And that's something that, as I said in my earlier answer, Madam Deputy Speaker, I think 3 or 4 months ahead. Historically, most civilian departments, I don't think, do. And that is what this pandemic has really taught us all, to think what's next. And as soon as you're solving today's problem, you should be actually moving on to think about the next one. And so very quickly on our response, for example, Tyert, the general in charge of the response, who I wanted to congratulate, was knighted in the honours list. Tyert, almost immediately, we said quite early on, right, you go back to the main job and the deputy will be the main liaison. That's what we do well, and I definitely think there is no barriers to that request. There's no barriers from other departments either. It's just if the demand is being generated either from the ground up or from other departments, that's when you see less or more, depending on what is required.
We now go to Virginia Crosby.
Thank you, Madam Deputy Speaker. Across the UK, our armed forces are helping to fight this invisible and deadly enemy by supporting COVID-19 testing. Indeed, led by Group Captain Andy Turk, personnel from RAF Valley in my constituency of Anismorn have been assisting local authorities in Manchester and Derbyshire. Our forces are giving so much to us during this pandemic alongside their critical defence work. Can my right honourable friend confirm when and how the vaccination programme will be rolled out to them?
Madam Deputy Speaker, the UK's Joint Committee on Vaccinations and Immunisation issued advice on priority groups for COVID on the 2nd of December. Prioritisation was governed by evidence regarding the risk of increased death rates and severe illness rather than occupational roles. With the exception of Defence Medical Services, frontline healthcare workers who are engaged in patient care or those with specific vulnerabilities, the majority of defence people are not expected to be included within that initial rollout. However, as I've said earlier in the answers, if they have key defence tasks, we are working with the rest of government to try and see to make sure they are priority at some stage after the first cohorts get their vaccinations. But I want to also pay tribute to the men and women of the RAF at Valley. They have done an amazing job, and not only out of area, obviously in Derbyshire, etc., where they've been helping, but it shows that it's not just the army. You know, the Prime Minister met members of the Navy yesterday involved in the vaccines. The RAF have been helping in landlocked Derbyshire as well, and I think it just shows that this is a multi-domain, multi-service effort.
John Speller.
Thank you, Madam Deputy Speaker, and I join the Secretary of State in paying tribute to the work of our military personnel on the front line in this crisis. But what is the role of them and ministers in setting the direction? How often does COBRA meet and do they attend? And he mentioned the constraint of stocks of vaccines. Isn't that now the crux of the matter and what is now holding us back? And what is being done about it?
Madam Deputy Speaker, well, first of all, we're not being held back. I think we've injected more people than anyone in Europe. In fact, not so long ago, more people in the whole of Europe put together. We are almost in the lead of the number of people being injected in a like-for-like. So nothing is being held back, and the government has placed the orders for enough vaccines for all of us over the period. At the same time, we are absolutely keen to step up to the plate to make sure that we get ahead of the problem, if there is a problem, and deliver it as it is, get ahead of it so we don't have a problem. That's what we're doing right now. I'm confident we will be there. I agitate most days to make sure that we're in the room. We are in the room. My honourable friend, the Minister of the Armed Forces, attends COVID-O, which is effectively the standing COBRA of COVID response, almost twice weekly, if not more, and we are always engaged in making sure there is a pan-government solution to this problem.
We now go to Faye Jones.
Thank you, Madam Deputy Speaker, and I declare an interest as my partner is currently on operational deployment overseas with the Army. Closer to home, I want to thank Brigadier Andrew Dawes, the head of the Army in Wales, who has supported both the Welsh and UK governments during the COVID pandemic. From his base at the barracks in Brecon, he and his team have helped to crew ambulances, coordinate mass testing, and have now established a vaccination support force. Will my right honourable friend join me in thanking Brigadier Dawes and all the staff at the barracks for their immense hard work? And given the operational significance of the barracks, will he also commit to reconsidering the future of the headquarters of the Army in Wales?
Well, first of all, can I pay tribute to her husband, who is doing the other part of the defence task, which is getting on and keeping our country safe at the same time as the rest of our armed forces are engaged in COVID. Look, I also want to say to her, look, I understand the concerns around the Brecon barracks and indeed the current headquarters of Wales. I know the Ministry of Defence Procurement has been to visit. There will be an announcement shortly on the future of that location.
We now go to Peter Grant.
Thank you, Madam Deputy Speaker. My constituency is one that has traditionally provided significant numbers of recruits, particularly to the Army. And whether these soldiers are in the front line against a military threat or against a deadly virus, they deserve the best equipment we can provide. But recent TV footage would seem to suggest that soldiers on frontline anti-COVID duties are wearing what looks to a layperson like pretty basic protective equipment. So can the Minister confirm that all military personnel working in potentially COVID hazardous environments will be provided with protective equipment to the full standards recommended by the relevant public health authorities?
Yes, all military personnel should be wearing and equipped with PPE as in line with the standards put out by the public health authorities. And just look, I know his constituency well, and I know that part of Scotland well, and I know that not only they deserve the best, which is one in his own constituency, I think is the one a defence industrial base, but also that they deserve the support of the whole of the United Kingdom, and I think the Scottish regiments are an important contribution to that.
Craig Williams.
Thank you, Madam Deputy Speaker. Can I thank the work of the Armed Forces in standing up to support the Welsh Ambulance Trust and also the planning and logistical support going on. As the Secretary of State alluded to, the training happens in the local authority of Powys, which in my Montgomeryshire constituency resides in. The vaccine rollout has been slowed to date, sadly, in Wales. Can the Secretary of State assure me any MACA requests or support for that vaccination rollout will be met with open arms and that the Ministry of Defence stands ready to support the Welsh vaccination effort?
I absolutely will support any request from the Welsh Government to increase vaccination delivery to people in Wales.
We now go to Holly Lynch.
Thank you very much, Madam Deputy Speaker. I've had very positive feedback from Calderdale Council about the support from military planners, which has been incredibly welcome. However, the biggest challenge to planning ahead has been the intermittent supply of the vaccines themselves. Can the Secretary of State assure us that he's working closely with public health colleagues to align the supply of the vaccine with the deployment of military resources in order to get as many doses out as quickly as possible?
Yes, we are. And, the vaccine delivery or jabbing of actually into people has increased on a daily basis and is consistently increasing up towards the Prime Minister's target in the middle of February. She will know that in Yorkshire and Humberside we've got 4 planners in South Yorkshire, 4 in Humber, 5 in West Yorkshire, 86 personnel supporting community testing in Kirklees, and 1 environmental health officer supporting the South Yorkshire region as a whole.
We now go to Lucy Allen.
Thank you, Madam Deputy Speaker. Telford is home to MOD Donington, a state-of-the-art army logistics site, so I know firsthand the way in which our armed forces excel at logistics. Will my right honourable friend do all that he can to ensure that this exceptional logistics expertise is used to work with the NHS to scale up our vaccine network and deliver the vaccine programme 24/7 as soon as vaccine supply allows?
Yes, my honourable friend, I visited Donington at the beginning of this outbreak when I saw them using that expertise to unload from China or other locations ventilators that had been brought into the country, and I saw at first hand the work they do. And it also reminds me of how important, as I've said earlier, the civil servants are and the other workforces within the armed forces. It's not just the uniformed personnel who are making it happen. As we speak, however, Donington is not required as a base for vaccination, MOD Donington, by Public Health England or the Department of Health. However, we are always open to suggestions and indeed, of course, the logistics requirement of COVID still will be routing through Donington. And the other expertise, the personnel, we've all seen Brigadier Prosser at the press conference give his expertise and knowledge in helping the response.
Ian Paisley.
Yeah, Madam Deputy Speaker, and once again this is an opportunity to allow us to thank the Army for the great work that they do, and I welcome the statement by the Secretary of State about the amount of civilian requests that the Army respond to. It certainly is a very impressive record. Yesterday the Minister for Employment in Northern Ireland asked for the Army to assist with COVID response in Northern Ireland. And indeed, a member of the Northern Ireland Health Committee, Jonathan Buckley, has called for the Army's logistical know-how to be deployed also. Will the Secretary of State assure the House that he will not spare Sinn Féin blushes in any way in the Northern Ireland Executive, and if the Army is required and have been called on, that they will be deployed and used appropriately in Northern Ireland?
I can give him that assurance, and there are plenty of people on all sides of the community who recognise what this is about. This is about a pandemic and fighting that pandemic. Even during the Troubles, when I was there were many people in nationalist West Belfast, for example, where I was there, who recognised the difference between security operations and indeed other operations and just getting on and helping people. And I fully expect the Northern Irish Executive to come forward with a request. We have some inbound, and we will support them, whoever they come from, whatever minister they come from, whatever ministry. If they require it, they need our help, they can have it.
We now go to Dame Cheryl Gillan.
Thank you, Madam Deputy Speaker. Just as examples of some of the military activity, in England, we see the military rapid reaction vaccination teams working. In Wales, military personnel are supporting health trusts and driving ambulances. In Scotland, they're supporting testing and vaccination. And in Northern Ireland, I understand the Defence Estate is loaned to the PSNI and they are facilitating Medivac. Would the Secretary of State agree with me that this, more than ever, shows the security, strength and benefit of our 4 nations being part of the United Kingdom, rather than a separatist agenda which would weaken the whole country and could have fragmented this valuable and essential response?
My right honourable friend makes a really important point. I am incredibly conscious when I send helicopters to the Highland Islands of Scotland when the Oxford AstraZeneca vaccine, a British-developed vaccine using all the skills of both the international community and indeed the United Kingdom community, that this is a whole-of-nation effort to attack this virus and rid it from these shores. And therefore, you cannot help but note that the British forces are truly that. They are British. People in my office, in my department, and indeed in all the regiments come from all 4 corners. And when this is over and we are judged, one of the questions will be, did we reach the fingertips of the United Kingdom? The armed forces make that happen.
We now go to Stephanie Peacock.
Thank you, Madam Deputy Speaker. I want to pay tribute to our armed forces who are working hard to keep us safe during the pandemic. Barnsley East has not been allocated a vaccine centre, so can I ask the Secretary of State if it is possible for the armed forces to support a vaccine rollout in my area?
The armed forces are there to help it happen in your area. If the regional NHS requests it or demands it, then of course we will be there to help set it up or man it or staff it. In addition to that, no doubt her GP surgeries, some of her surgeries will be delivering the vaccine, and not far away, obviously in other parts of West Yorkshire, we've got 86 personnel in the community testing. We've got the planners, as I listed earlier, in South Yorkshire, Humber and West Yorkshire. So they are there, they are in listening mode, they're also delivering other assistance. If they require more assistance, either from the local authority or the regional NHS, we'll be there to deliver it.
Well, I'm afraid this will have to be the last question, because I have allowed it to run at least 10 minutes over the allocated time. However, I would draw colleagues' attention who are in the chamber to the fact that there is a debate shortly on COVID, and they may wish to intervene perhaps on the Minister in the next debate. Final question from Sarah Brickley.
Thank you, Madam Deputy Speaker. Our armed forces really are the very best in the world, but can my right honourable friend confirm that the Army are working closely with local councils such as our own in Lancashire to set up our vaccine network and use battle preparation techniques to help us keep up the pace?
Yes, I can. I visited that northwest region sort of hub at Preston on Thursday and met and spoke with a number of the leaders of the councils, including her own, and we are helping right now. And, you know, what's really important here is that Whitehall recognises that local authorities are very, very important in finding those people that need a vaccine or need testing. One of the lessons of Liverpool was even when you set up a testing site literally outside the front door of certain people, the key people you need tested or the key people you need vaccinated don't always come forward. The local authorities will be a key plank in making sure we close the final mile on vaccines, and that's why we will continue to work with them, both as Defence and the Department of Health.
I thank the Secretary of State for the statement. Point of order, Sir Ian Duncan-Smith.
I rise to seek your advice about an issue which is in my constituency and I'm unable to get redress on. The fact is there is an organisation, a company which is a social enterprise called Clarity, who employs essentially people with disabilities. They work hard and they have done for many, many years. Sadly, about a year ago, it was taken over by a Mr. Marks. And since then, they have failed to receive their national insurance contributions, many of them their wages, many of them their support whilst away in childcare. The total amount is around £200,000 now that these decent but very vulnerable people have failed to receive. They can't claim benefits because they are essentially employed. And so I rise to ask, I've pushed my right honourable friends in the Treasury to answer whether they would give them interim payments, but I've received no answer, and I have received a debate in the House before Christmas. Clearly, it's a lottery, and I've failed. I wonder, Madam Deputy Speaker, these are the most vulnerable people, but also the most decent, hard-working and brilliant people. I wonder, I seek your advice, how can I possibly get my government to address this significant problem?
Well, I thank the right honourable member for that point of order and for giving me notice of it. He has clearly succeeded in raising the issue and brought it to the attention of the House by raising his point of order. I know that the Treasury bench will have heard what he has to say and will feed that back. I assume in the first instance that he perhaps might like to raise this, for example, during the business statement to ask for a debate. But I also know that the Leader of the House has made very clear if honourable and right honourable members are not satisfied with the speed at which they are getting responses from government departments, that they should bring that to his attention and ask for him to ensure that a response is forthcoming. There are obviously other ways that I'm sure the Public Bill Office and so the Table Office would be happy to give him advice on how he might like to raise the issue through other mechanisms as well. I hope that's helpful, but as I say, he has clearly raised the plight of his constituents successfully once this afternoon at least. Thank you. In order to allow the safe exit of right honourable members from this debate and to prepare for the next, we'll have a 3-minute suspension.